Hello, everyone. My name is Cynthia Sims, and I'm here to talk to you today about vocal nodules as they are specific to you, teachers. Um, I do want to let you know, first of all, that I did find out a fact. I don't know if it's a fun fact, but it is a fact that teachers are twice more likely than any other person in any other profession to have voice problems and 3 times more likely to have to go see a doctor for their specific concern. So I don't know if you know that you use your voice that much, but I just wanted to let you know that little nugget of knowledge that I did find out. That was in an article by a Miss Long in an NEA article that she wrote. But I do want to first off educate you on what vocal nodules are. Vocal nodules are little bumps that will appear on your vocal folds. So your vocal folds should appear, you have 2 of them, one on each side, and they should appear very smooth on both sides. When a nodule forms, it's going to kind of make it a little bit more wavy. They're going to look a little like callus-like. And it's basically just a growth. It's benign, they are non-cancerous, but it's when you use your voice in the wrong way, your vocal folds will swell. And from over time, that swelling and those spots can harden and they become like a callus-like um, formation. So these nodules can get larger and they can get stiffer if you abuse your voice for a longer period of time. So basically, the things you want to look out for is if your voice starts getting a little hoarse, if you're feeling like you're getting very breathy with your voice, or if you have a rough voice, if it feels scratchy, if you feel pain, um, less ability to change your pitch. So if you're having problems going from a high to a low voice. Also, you tend to get more tired. Like you feel like your voice is just tired and you don't really want to use it anymore. Um, on the pamphlet that I do have for you today, and you're each going to get one, is a picture. So it'll show you what a healthy vocal cord looks like what the vocal cords look like and what they look like when they're normal, and also what they will look like when there's nodules inside. Potential causes in your daily routine would be like speaking loudly in class to students, speaking for extended amounts of time, helping at school events that require you to use a lot of like a louder tone of voice, having to raise your voice or pitch based on background noise in the classroom. Also like extended amounts or time of reading that can also go affect the vocal folds and overuse them. Some tips on preventative care. We want to give your voice a break. So, stop the shouting, stop any yelling, make sure you stay hydrated. Having nice hydrated vocal folds is going to make sure to keep them healthy, keep them lubricated, not let them get dry while they're connecting while you're using them. Reduce any background noise if possible. So in the classroom, anything else that might be going around in the background, you want to minimize that. Also, we want to, if you can, and if your district allows, acquire some good acoustics. So if we have like a little microphone system where you don't have to really be yelling a whole lot, that would also benefit you. And just if you do notice any of the warning signs that maybe there might be something wrong, and if these things do last longer than 2 to 3 weeks, then it's time to go seek medical attention. Where to seek help? Where do you go? So on top of going to your primary care, of course, you might want to also request to see an otolaryngologist or an ENT, ear, nose, and throat doctor. Those are usually the best options. They might also refer you to see a neurologist or an allergist because it may be like allergy related, or other doctors if they're necessary. An SLP in this situation can test how your voice sounds, so the quality of your voice. They can apply the appropriate therapies and teach you different vocal hygiene methods that may help you to save your voice. Some treatment options. There are many treatment options available, but it's all dependent on the cause, the size of the nodules, and also the problems that you're experiencing. Surgery can also be an option, but it's very rarely used. After medical treatment, an SLP will work hand in hand with the doctor to get you the best voice therapies possible. And that is all for my presentation. I hoped you learned a little bit more about vocal nodules and how to prevent them and how to save your voice, because teachers are important. And I just wanted to thank you for all that you do. And if you do have any more questions, don't hesitate to call your medical professional or your local or your SLP. If you have any questions, they could also direct you. All right. Thank you. Have a great day.